Good. And you can tell I'm excited to be here. I'm not your regular moderator, so let's get this started the right way. Good afternoon, and welcome to the Flint Community Webinar on Coronavirus. Today is Friday, April 22nd, 2022, and this is our 110th consecutive webinar. Our webinars are brought to you by the Flint Center for Health Equity Solutions, the Healthy Flint Research Coordinating Center, and the Michigan Prevention Research Center. I mentioned this. I am Heather Lynn Uphold from Michigan State University, filling in for our regular moderator, Yvonnie, who is taking a couple of well-deserved days off, and I am so excited to be here with you. We have a great lineup for you today, but you know, we couldn't be here, we couldn't be doing this without our wonderful partners who bring tremendous expertise. They bring resources, local information, and the logos that you see here. Each one of these logos represent folks who show up every single week to answer the questions that you put in the Q&A. So let's make sure, you know, if you've been out and about this week and you want to, you know, something came up, get that question in and we will do our best to answer it for you. If we can't get to it this week, we'll get to it next week for sure. We want to make sure that you are included in this. I mentioned that we have a great lineup for you, and it includes our roundtable conversation that begins with COVID equity. We've got folks from the Genesee Health System who'll be here to talk about grief support and substance use. And we'll also get a tour of the COVID data dashboard. And then we'll get our important updates from the health department and the city of Flint. So lots of great stuff for us to look forward to hearing about. But before we get there, I want to give us a reminder. We've been talking about how all month, this month of April, is National Minority Health Month. And this year's focus is give your community a boost. And here's the thing. It's hard to give your community a boost if you haven't first taken care of yourself. It's supposed to be beautiful here in Michigan this weekend. So if you can get out, get some sun, get some good rest, some good food in you so that you can then come and join us for a couple of events that we have going on this week. One in particular is on Monday at 2 p.m. It is sponsored by the Flint H2O Justice Group. It's commemorating the 8-year anniversary of the Flint water crisis. You can check it out. It's being held at Kersley Park, where there will be some speakers. We've got some great resources for you. Make sure you go to the Flint H2O Justice Facebook page for more information. And then also the Healthy Flint Research Coordinating Center. We're hosting a community conversation on April 28th, that's this upcoming Thursday, around indoor air quality in homes. This is an open dialogue with the EPA, so we encourage you, sign up, join that conversation. We're going to put the registration link in the chat, but you can always go to the HFRCC Facebook page and find out more information. So let's move into our roundtable. I'm going to invite, we've got some great folks here for you this week. Let's do Dr. Wolfert, Dr. Hackert, Dr. Sadler, Katie, Carrie, come on in, because nationwide, we are seeing a shift in the conversation. We're seeing that the guidelines are relaxing. You know, we even talked last week, Dr. Furholden mentioned how we're using softer language. Instead of surge, we're saying uptick and those sorts of things. And even this week, we saw a change in mask requirements while traveling, but COVID is still very real, still affecting people. So you guys, give us your take on this. Why is equity so important? What are the things we need to be thinking about with this?
So I'm going to jump in here, Evelyn, and say that I think what you said a little bit earlier about looking after one's own health is so important at this moment. So I was mortified to see this change this week with the mask mandates, particularly as I have to fly in 2 days. I just could not believe that that had changed. But certainly what it makes me think of is that fact that I have to be more careful myself, because I cannot guarantee that the rules are going to help keep me safe. So I will definitely be wearing a KN95 or N95 when I'm on the plane, when I'm around people, because while the numbers are lower than they have been at other times, it doesn't mean that there's zero risk. And so I want to protect myself, and so that's one thing I will be doing, continuing to wear my mask in places where I think I might be exposed. The other thing is to be sure that I do as much as I can to be as healthy as I can, so that if I come in contact with it, my course will be less severe, hopefully, right? None of us know that for a fact, but it appears that we really are, as Dr. Reynolds would say if he were here, one of those layers of protection is using our own thought processes, brain, intellect, to decide how we can protect ourselves.
And I would just like to add how important it is to be kind to ourselves right now during this difficult time, because there are so many changes going on and lots of feelings about that. And it's very difficult and overwhelming. Just recently, my husband went into a store, and it was just a small local store, and they were saying, we still require masks here, and she was talking about it, and she was talking about all the changes, and she was so worried about what are they going to do about this and that, and you could just he was just saying you could just see the stress she was under with all of this. So I think we have to remember to take a deep breath, and we know what to do. We've learned a lot about this. We know what protections we have, and to go ahead and to do those things, but also to remember to be kind to ourselves and to support each other through this difficult time, because we're all still going through this together after all of this time.
You know, and that's so important to keep in mind, because we aren't back to normal. We aren't going to have a normal, right? Like what we had before. I see we've got Nurse T. Thanks for joining us, Nurse T. Dr. Hackert. You know, throughout COVID, one of the things that Genesee County and Flint has done really well is really try to keep, available information, resources, vaccines, testing, those sorts of things. And that's been really important to make sure that we keep equity at the forefront and really highlighting how important that is. Pam, Dr. Hackert, can you talk about that?
Can you rephrase that question?
Yeah. How important it's been to keep equity and keep resources available to our community.
So it is critical. And I think that the recent weeks changes with like the masking really hits home how this is something that is fundamental, and we need to keep equity and also the understanding of like where people are medically sophisticated, or like, where are we talking about? And so, and it's not like training, it's not education, because we saw that with that the example of the judge that you had said. She's obviously an educated woman, and they were really off. She was really off on that decision, because her decision was based on the common use of the word sanitation now, as opposed to why the CDC uses the word sanitation, because departments of public health used to be called Department of Sanitation, because it was mostly involved with the diseases born in the water and the air, like pollution from the whole industrial revolution. And so by focusing on the current definition of sanitation, like you take a Lysol wipe and wipe up things, she was very off base. And for someone who, and I'm not meaning to be political, seriously, I'm not, but for someone who really, values the interpretation of the Constitution at the historical context, I think that it was, kind of a miss to not have looked at how that really should have been interpreted. And because the current definition for medical purposes or for public health purposes is the same as it always was back when it was first developed. And that is really the procedures and the study of, like, I'll even read it because I had it here. The study and application of procedures and measures designed to protect public health. That's all sanitation means. And so by striking down the mask mandate on public transportation, she's doing a huge disservice. And there are some very early studies showing that the risk in airplanes is actually significant. It's truly still high. So I will be wearing my mask in crowded situations, indoors, and on the airplanes.
Just add to that, Evelyn, that if we cast our minds back to the beginning of this pandemic, we remember that African Americans and people of color were very much more likely to come in contact with COVID. It's more likely to get COVID, more likely to have severe outcomes from COVID. We had all these disparities. And many people noted that part of the reason, and there are lots of reasons for it, but part of the reason was that many people in communities of color were essential workers. They were on the front lines, and we didn't have masks for people to use, right? So it was clear that one of those layers of protection was not there. And so we shouldn't forget how the absence of that layer of protection put communities of color at risk. And so now that they're removing the mask mandate, we have to again wonder, how is this going to put people of color at even greater risk than needs to be the case?
Exactly. And in our haste to return to normalcy, we've forgotten all of those things that we experienced early on. So Yvonne, who's supposed to be on vacation, has her hand up. Yvonne, come on into the conversation. Join us.
Well, hello. I thought I didn't realize I had my hand up because it's a little bit noisy in here, but I am in an airport. And I will say that there is a variety of exposures here, but also people thinking about this very differently. I'm pleasantly surprised, delighted to see how many people are wearing a mask, even though the mask mandates have been lifted, even on the airplane. So I think it is important, as you said already, let's all do what we need to do to keep ourselves safe, because you're the person in first in line. So take care of yourself so we can take care of others. And thank you, Heather.
I got you. We do this together. Dr. Sadler, do you have anything to add to this? You were handling the data for us early on, and I know you're going to walk us through the dashboard, so I don't want to do a spoiler alert or anything for what you're going to share later on. But can you talk about that? What we saw in the data early on about inequities?
Sure. I mean, I know a lot of what we were seeing in early data drove a lot of the advocacy efforts that have been present on this webinar over the last 2 years. There were huge disparities in case rates between African Americans and whites in Genesee County in the first 3 months of the pandemic. And those were virtually eliminated by the time of the fall 2020 surge. And I mean, I think there's something to be said for the amount of advocacy and outreach and the heed paid to all of this information in the Flint community that contributed to the racial disparity going away. Some of the early racial disparity could have been just bad luck. It could have been connected to the nature of like where it spread, job classifications. But yeah, we saw not just in cases, but in deaths, in fact, in the first 3, 4, or 5 months of the pandemic, hugely disproportionately affecting the African American community. So I know our team's been heartened to see the data coming out over and over. And even the last huge wave that we experienced this winter, deaths didn't surge as high as they had before, which again, we can attribute to vaccination rates and the fact that a lot of people were protected. So yeah, I mean, it's been nice to be able to, it's a funny word to use, but nice to be able to use the data to see that these disparities aren't reemerging time and time again.
Exactly. And Dr. Hackert, you were right there with us. We are in partnership with you at us at MSU in looking at this data. Anything that you can add to that?
Yeah, so that's my concern with this, taking the mask off, which protects everyone around ourselves and also protects ourselves, is taking those masks off or making it seem like that is the thing you should be doing. Because I'm glad that Yvonne's got people masking, but my husband was on an airplane yesterday and he said that of the 150 people on the plane, only three people had their masks on because he walked up and down the aisle, 3. And so he was one of them. and so I think that then when you think of the frontline exposure of, the essential workers, the communities of colors like tend to have, or the smaller home spaces that, the crowd, my biggest concern is with this, taking the mask off, our vaccine numbers are still dismally low. And while we're still trying to get people to come in and get the vaccines, we know with Omicron, you have to complete it. So we have 45% of completed, still incredibly low. and 54% who initiated it. But even to bring up those 45, or bring up the 45 up to the 54 completed, would be a huge help. But we really have, it's like, that is going to be the most vulnerable thing, is people who, are around, having to be around people, even if they're wearing masks. You have to be around someone who's coughing right in your face. You don't have the social standing, as a frontline clerk and a cashier kind of thing, to say, cover your cough. And they're exposed and not vaccinated. So we really have to try and encourage people to get vaccinated now. We have the safety profile. It's like a year and a half now. We know it's safe. We know it's effective. And that's my fear, is that we're going to see people who are unvaccinated, who previously were protected by masking.
Yeah, and just even more exposure. Nurse T, we see you.
Yes, I have a concern because right now we have a high rise of the flu. So the flu symptoms, and the flu is very contagious as well. So people cannot be positive for COVID, but they can have the flu. And if they're not wearing their mask and using proper precautions, they're still spreading a virus and people are going to be sick. So I would still encourage people to wear their masks if you're not feeling well, especially now. Sore throat is on the rise. We got hay fever and allergy season. So it's a lot of other issues that's causing sickness. And then once again, the Black and brown community is at risk, because now we may have flu and feel fine and not be positive for COVID, but we're somewhere coughing and still passing along germs. So we still got to be mindful, because any kind of virus or sickness can still be contagious.
Yeah, so important to remember, and that our work is not done here, right? There's still a lot of things that we need to be learning about, need to be keeping in the front of our mind. And we are so grateful to have each and every one of you join us every single week for this, for these important conversations. I'm going to transition us now to hear from Dr. Rick Sadler. So Rick, some of you may know this. He is the man behind our data. You might recall that when we present our the health equity brief, Rick is our data guy. He's also our community's map guy. He's an associate professor in the Division of Public Health at MSU, and he and his team have been hard at work providing us with up-to-date data and a great community resource that he's going to talk about.
Yeah, thank you. So I'm going to do two things. The first is I'm going to share this dashboard, and then I'm going to hop back into the slides in a couple minutes here and go over the data update for this week. So if you are not familiar, we have a disparities dashboard that's housed on the Genesee County Health Department's website, and it's underneath the Genesee COVID-19 Disparities Dashboard tab. So when you open it, it looks something like this. And what it does, the whole point behind this was because of the disparities in race that we were seeing in the data and wanting to get that data out to folks, disaggregated as much as possible while still protecting health information. So what we've done is we highlight these by municipality or by city or village. So what that does is it allows us to break up the county data into a little bit smaller units and see some patterning. And so I want to bring your attention to that here. And so in the map, what this map is showing right now is the case rates per capita or per 100,000 population. And so what it's saying is the last 5 weeks, case rates have been higher per capita in Goodrich and Grand Blanc Township and Flushing, and relatively lower in Flint. So that's a good thing for Flint residents, at least, maybe not for the suburban residents. But another thing that you can see across the bottom are these 3 different tabs. And we've started showing cases for the last 5 weeks because we had so much data going into this dashboard. It was really slowing it down. So we have a 5-week snapshot. What you can see is that there has been an increase in cases, but when you go to the overall pattern, you do see that we're still a lot lower. So, definitely something we need to keep our eyes on when we look at case rates increasing. But when we look at the big picture, it's nowhere near where we were this winter or in the 2 waves that we experienced over the last couple of years before that. We also have the number of cases per race, per place. And one thing that we, again, are working to do is highlight these not just as sheer numbers, but per capita, because we know the city of Flint, Grand Blanc Township, and Burton and Flint Township are our bigger municipalities anyways. So of course there will be more cases. But again, one of the things we do is highlight these cases by week and by place, by race. And so the last thing I want to share about this dashboard is that we have these gray numbers here, and these are unknowns. And we've had a big issue collecting, getting race collected for all COVID cases. That abates over time as some more information gets updated to those records. But we see that as important because then we can illustrate what the potential racial disparities are, not just between whites, African Americans, and other races, but with respect to those unknown cases that we don't actually know who those people are. I'm gonna stop my share and then we'll jump into the data update for this week. And one thing I did want to say about the dashboard is we're always looking for feedback on functionality of the dashboard, what other kinds of data you might like to see in that. I guess like other kinds of permutations of COVID data, of course, because it's a COVID disparities dashboard. Okay, so here's just another view of, I guess, kind of what I showed you on the dashboard. We make these figures from data that we upload to the dashboard, so it's the same data. But again, what we're seeing this week in Genesee County is for the second consecutive week, a bit of an increase in the number of cases. You do see a large number of unknown cases for this week, number 111. And again, that's partly because as we get updates to cases over time, those unknowns become knowns. And so they kind of diminish as we go back in time. But yeah, so we've seen 136 new cases in Genesee County, 34 more in Flint. But even more importantly, the testing positivity rate has nearly doubled in just the last week. So those are just a couple of things I wanted to highlight. I think that's it for me.
All right. Thank you so much, Rick. We are going to look forward to hearing more from you in the coming weeks as you present us with the data and this wonderful resource that is available, to community. And it comes from our partnership with the Genesee County Health Department, which is so important. So wonderful stuff. Thank you so much. And and let's make sure that we put your contact information in the chat so that folks can reach out to you, because your email address, excuse me, Rick's email address is Sadler, that's SADLERR, so double R in that, at msu.edu. So make sure that you reach out. All right, up next we have from the Genesee Health System is Katie Baxter. Katie is the Senior Director of Clinical Services, and she's going to be talking to us about grief and bereavement.
Thank you so much, Heather Lynn, for inviting me and always having mental health at the table. So thank you so much. I want to talk about grief and bereavement, this important topic. I want to note that there is a difference between grief and bereavement. Grief it describes a general type of loss. It could include the loss of a loved one, but we could be grieving the loss of functioning if we had a stroke and were unable to walk, or if we had a house fire and lost our home, or some other kind of economic or financial loss. So we can grieve in a lot of different kinds of ways from loss, but bereavement is specifically related to the death of a loved one. But we'll talk a little bit, somewhat interchangeable, of these terms. I want to talk about the impact on grief on our children. The National Child Traumatic Stress Network defines childhood traumatic grief as when a child perceives the death of a significant person as traumatic. So it has a lot to do with how the child perceives that loss of the person, of how close they were, how important that person was to them, and how they died. The death may have been sudden and unexpected. It could have been a heart attack or a car accident or something like that, or anticipated an illness or natural causes. But keep in mind with COVID that we had many people who passed away that we did not expect they would pass away. They were otherwise fairly healthy. So that can be very traumatic for children. The next slide. These are some statistics that are important. Only about 5% of children experience parent death before 18. But the numbers grow as you look at some other kinds of things, like 20% witness a death. 40% deal with the death of a close friend of their own age. And about half of the youth under age 21 in urban inner cities experience the sudden unexpected death of a close relative or friend. That's a lot of children impacted by a sudden death. And about 90%, so many high school students experience the death of a grandparent, aunt, uncle, sibling, or another special person in their life. So children have been significantly impacted by grief and loss, and especially during the pandemic. I want to talk a little bit about loss and disparities. We talked about this before, about orphanhood for children, and particularly Black and brown children. But first of all, I want to note that over 200,000 kids in the United States have lost a parent or caregiver to COVID. That's a lot of children impacted by bereavement. So, but this is interesting. If you look at this number here, only 1 in 753 white children were orphaned as a result of death of a grandparent caregiver from COVID. But if you look at Hispanic children, 1 in 412, Black children, 1 in 310, and American Indian and Alaskan Native children, 1 in 48. So we're really disproportionately impacted by the death of a caregiver, particularly a grandparent caregiver. So it's important that we're aware of these kinds of disparities. I want to talk about something called prolonged grief disorder, or PDG. Sometimes it's called complicated grief, but it's important to know that many of us do experience grief or bereavement, and we're able to get through that with our own resiliency and coping skills and the support of natural supports we have, but not everybody's able to do that. And there is a difference to note between a normal grieving process that we go through to something we call prolonged grief disorder. So with prolonged grief disorder, it persists over a significant amount of time, and it doesn't diminish like it should gradually in a normal grieving process. And basically, it affects the way we function every day. So if we're finding that we're impacted with complicated or PDG grief, then we'll talk about ways to get some help for that. The prevalence of PDG. About 1 in 10 people who have lost somebody struggle with PGD. So it's fairly common, 10% of our population. And PDG puts us at higher risk for medical problems like cancer, high blood pressure, heart, or immune issues, and other behavioral health issues, disabilities, hospitalization, and suicide. It's so important to remember that the connection between the mind and the body, that when we're affected, our mind is affected, it also affects our body. These two things go together. When do we know we need to seek help for grief or bereavement? These are some of the things we need to look out for. If symptoms continue to persist over an extended period of time and affect our daily functioning, certainly if we have suicidal thoughts or ongoing serious symptoms of depression, lots of crying spells, insomnia, panic attacks, these kinds of things. If the person can't accept or believe that the person is really dead, or if they're going places looking to see that person or avoiding situations that remind them of that person. Also, if there's abuse of substances, alcohol or drugs or other kinds of addictive behaviors, that tells us that we need to reach out for help. Also, if others are noticing that we're just not ourselves, we're not doing well, they're seeing that we're not functioning well, that's another indication. If we're withdrawing and avoiding social interactions, or we don't have a support system. Some of us are fortunate to have very strong support systems, but not everybody has that. And that's important. If we don't have a support system, we might need additional support. If we're suffering from unexplained illnesses or somatic conditions, and we talked about that a little bit earlier in the slide, medical things that can come up from grief and loss. If we've experienced lots of losses in a short amount of time, that can be really hard to bounce back because it's a cumulative grief we're dealing with. Or if we find ourselves blaming ourselves for the loss of a loved one, we have survivor guilt, you might hear that term, or we regret some things. We have really severe issues of regret about that relationship with the person who is deceased. Also, if we're plagued with real intrusive thoughts and we're reliving the circumstances of that person's death, these are all indications that we need more than just the help of family, friends, or we need additional coping skills to help us get through that. So I want to talk about the next slide. It's about treatment options. There is good treatment for people experiencing grief and prolonged grief. So I want to talk about medications. Medications, particularly antidepressants, have been shown to be effective with people experiencing grief, especially we look at our SSRIs, like you think about Paxil or Celexa. Those kinds of medications can be very helpful with people going through grief. We don't see the same efficacy typically with triglycerides antidepressants, but the person would work with their doctor, their prescriber, or psychiatrist to determine the right medication for them in that experience. And also psychotherapy. Therapy is so important, particularly cognitive behavioral therapy, and we find that if there's both group and individual options that can be very effective for people going through grief. But what we do know is the combination of both psychotherapy and medication therapy are typically the most effective ways of dealing with grief and loss. So this support is available, so we do not have to suffer. We can reach out and we can get the help and feel some relief from the challenges we're experiencing. I want to move on to talk about local resources that we have. We have so many resources in our community, more than we've ever had, and we want to encourage people to reach out and get help. There's nothing wrong with asking for help when you need help. We have a crisis hotline number that hasn't changed, 257-3740, 24 hours a day, 7 days a week. And that's also the number you would use if you're seeking non-emergent behavioral health needs, including substance abuse or counseling. And our address is 420 West 5th Avenue, 8 a.m. to 5 p.m. We're open for non-emergent needs. We also have something called ICSS, or Intensive Crisis Stabilization Services for children. And that's the same number you would call if a parent is having challenges with their child. It doesn't have to be a full-blown crisis, but it can be a crisis to them. They can call this number and get the support they need very quickly. We also have our behavioral health urgent care video chat option. You do not have to have a diagnosable mental health condition to want help and to reach out and utilize this. Please feel free to use this option. We found we've gotten really good feedback of people who have used that resource. We also have our BHU walk-in services. Currently, they are 8 a.m. to 10:30 p.m., and we close generally by midnight. So that's additional resource. So if people don't want to go to the emergency room when they're having a mental health crisis, they can go to the BHUC. Also keep in mind, we have the option of texting. Text Flint to 741-741. That is a great option for adolescents who are comfortable using the texting option, might want to know about that resource. We also, in terms of grief support specifically, we have a couple different resources primarily for adults and kids. Ellie's Place is a terrific resource here in Genesee County to help kids going through grief and loss. Their number is 232-3040. And we also have a virtual grief support group that GHS provides that is on Thursdays, 4 to 5:30 p.m. And if you want to participate in that, you would call the number 810-257-3777. All of these resources are available on our website, so we encourage you to go there at any time, and you can always reach out and contact me if you had any questions of any of these kinds of services. So I want to thank you for your time and for listening, and please remember, again, I know I've said it before, but it's important to ask for help when you need it, and there's nothing wrong with doing that. So we want to encourage people to get the support they need. Thank you so much, and I think we have Carrie coming to talk about some substance abuse and some other educational resources. Thank you so much.
We do. And Katie, we are so glad that you come and join us on the webinar, that we have the Genesee Health System as a part of our community, because you're exactly right. We don't get to schedule death. We don't get to schedule grief, and all of those things can come at us in waves. So having these resources is so important.
Thank you.
We are looking forward to hearing from Carrie Chanter. Carrie is the manager of co-occurring service integration at the Genesee Health System. And Carrie is going to talk to us about substance use during COVID.
Good afternoon, everybody. Thank you so much for asking me to talk briefly about substance use during the pandemic. Next slide, please. There's basically three main points I want to briefly cover. And the first one is that researchers are really seeing a huge increase in substance use during the pandemic. So like there's provisional data, again, that's provisional. We're seeing a huge spike in drug overdoses. More than 93,000 drug overdose deaths were estimated to have occurred in the US in 2020. That's the highest number of overdose deaths ever recorded in a 12-month period. I'm going to say that again, that is the highest number of deaths ever recorded in a 12-month period, and nearly a 30% increase from the year prior in 2019. So not only are our substance use numbers going up, but also the drug overdoses and the negative outcomes from drug use are increasing. Why? Well, it's complicated, it's complex, but we believe that it has to do a lot with the social isolation and the stress that we all felt during the pandemic and continue to feel during the pandemic. So that pandemic related stress and the isolation that people have had to endure over the last couple of years are likely contributing to the increase in substance use and the poor outcomes that we're seeing from the substance use, like overdoses. So it's important to remember that we have absolutely seen an increase in substance use and poor outcomes. But also the second point I want to make is that sometimes we think about different groups being disproportionately affected. And I would add, sometimes we forget about the people that use substances. And we need to remember that people that use substances or have a substance use disorder are at an increased risk of poor COVID outcomes. The research is still kind of evolving about the susceptibility of how substance use affects susceptibility of COVID-19, but we know that smoking and substance use disorders are on that list of underlying medical conditions by the CDC for negative outcomes of COVID-19. So we know that those two conditions are on that list. We also know that smoking or vaping drugs like tobacco, nicotine, marijuana, heroin and crack, cocaine, we know have been shown to worsen lung conditions like COPD and asthma. And we know, so then we also know that chronic lung diseases make somebody more likely to be severely ill or die from COVID-19. So we can make that connection right away. So that second point is, yep, people that use substances certainly are at greater risk of getting severely ill or dying from COVID-19. And the last point I really wanted to make on this is that, the pandemic really has posed some unique challenges for people that have substance use disorder and those who are in their recovery. So if you know somebody who's experiencing or recovering from a substance use disorder, now may be a good time to reach out to them, see how they're doing, remind them that they are loved, connect them to resources. We know that people that are in recovery, that isolation is so bad, right? It's bad for their recovery, because we know that the social support is so important for people that are in recovery. So to not have that is certainly a risk factor of relapse, and we don't want to see that happen. When we had the physical distancing measures and the quarantines and things like that, that did not help people that are used to being in-person meetings and peer support groups and other sources of social connections that they're used to having to support their recovery. So we know that although a lot of the in-person recovery support groups are starting to kind of come more in person, the good thing is that we have seen some virtual meetings take place, and, the increase in telehealth counseling has certainly expanded. So that's been a nice thing that we've seen happen, but different meetings are starting to come back to in person. So that's good. So I would just remind everybody that if you have somebody that is using substances or is, in recovery for the substance use disorder, now is the time to reach out to them. And because sometimes, they just need to hear from somebody that you care. So make sure that you're reaching out to them and doing so. Could you go to the next slide? And I just want to remind everybody somewhat of what Katie talked about, the Access Center. So our Access Center doesn't only screen for mental illness, but it also screens for substance use disorder. So they can call this number at any time, and what they do is it determines eligibility for different treatment options for somebody that is suffering with a substance use disorder. And depending on how they score and the different screening tools, they will be placed and authorized into different levels of treatment. Next slide. Since we were talking about substance use, I thought it was a really opportune time to talk about a really important resource in our community. We're so excited to be able to present a webinar series. It's a 3-part series with the Tall Cop. The Tall Cop is a nationally known speaker. His name is Jermaine Galloway, and he's been presenting for years. And again, we're so lucky that we were able to secure him for Genesee County. We did have our first one this week, but we still have 2 more. And he talks about drug trends. The series is called High in Plain Sight, Current and Evolving Drug Trends. And it is provided by PA2 and we are offering McBath and social work credits. Next slide. So at the bottom of this flyer, so we already know that Monday has already taken place, but the one in May and June are up here, and you can always scan your phone right now with the QR code or follow up on the GHS Facebook page. We have a link to the registration there as well. So registration is required. This next one in May is going to talk about school and youth-based drug trends. And the one in June is about synthetics and opioid and street drug trends like fentanyl and meth. So next slide. And I think that's it. So I appreciate the time today, and I'll hand it back over to you, Heatherlyn.
All right, wonderful. Thank you so much for coming on, sharing those great resources for us. I'm going to slide in something real quick, because this is the wonderful thing about the webinar is that you put those questions in the Q&A, and we have folks here that can answer them. So one that came in, I'm concerned about stress. Flu, as Nurse T advised, and recently the DNR advised about avian flu. I don't know if you all have been hearing about this, but that's being found in bird feeders, and bird feeders should be taken down. But here's the question: how do we move forward without seeming like anxious people when some of us simply think masking is an effective tool to prevent common illness that can be seasonally implemented, especially in schools? And we have Dr. Hackert with us that's gonna give us a response to that.
You are a wise woman, that Lizzie, who had sent the question in. It's so true. And I think it really has to be a shift of our societal thinking that this is normal. And I lived in Japan. I know I've mentioned it once or twice, but I lived in Japan for 2 years, 20 years ago. And that was the norm when there was something spreading in the community. I don't recall if children were wearing their masks, but nonetheless, like, it was the common thing. And it seemed very strange at first to me, and people were wearing cloth masks. But by the end of 2 years, I had kind of gotten used to it. So I think we just have to remember that much of this kind of division of people's, like be able to judge each other based on whether we're wearing a mask or not is something that has been strangely forced upon us in the last couple of years. And it wasn't that way before. It wasn't that way in the future. I mean, so I think it's something we have to keep talking about, keep doing modeling studies to show that it is effective, and not let the effectiveness of it get forgotten. And so I commend you. I recommend you to do that. And I managed to have trained 3 20-year-olds to do their masks as well. So hooray. So I think it really just is going to be something we have to work on as a society. Remember when people used to judge, well, many of you don't, but some of you will. Remember when people used to judge people by their hair length. So, you know, like in the 70s, I was a kid, and I still remember people talking about, they had songs about, you know, is that person a boy or a girl kind of thing. And so like that was unusual. We don't blink now at all. You know, now it's more like, would you like the earring in his ear? You know, is it face hair, yes or no? So it's like, I think we just have to remember that we will shift as a society to understanding that this is something that is a personal choice. It helps protect others. So if your personal choice is to be helpful and keep the disease transmission down in the community, then we should be wearing masks when the numbers are high.
I love it. And just normalize it, right? Yeah.
Yeah.
And well done training those 3 20-year-olds. Thank you so much for jumping in and answering that great question. We are going to transition to hearing from Ashley Herbig from the Genesee County Health Department, where Ashley is the Emergency Preparedness Coordinator. She's going to bring us some updates.
I would love to. So as of April 18th, we had a reported total cases of 101,636 cases. Today, we are at 101,852. So we are seeing an increase. This was covered earlier in the webinar, so this should not come as a surprise. In the past week, our trend of new confirmed cases by referral date has increased by 9%. If we look at probable and confirmed cases referred, we see a 7% increase. At this time, we are monitoring 2 active outbreaks within the county and maintaining continuous communication, as well as coordination of resources for both outbreaks. Our statistics and our data has definitely not wavered too much. We haven't seen a whole lot of activity as we would like it to be, but we do go forward with a cautious mindset. Next slide. So vaccination in Genesee County is an ongoing effort. We are still continuing to offer our weekly vaccination clinics with pop-up clinics. I'll go over those shortly. To date, 404,029 total doses have been administered in Genesee County, of which 84,433 have been given by GCHD and various partnered organizations. So in this case, we do partner with the Michigan National Guard, Michigan United, and other partners. We have seen a 70% increase in hospitalized cases of COVID between yesterday and today. That seems intense, it is not. Yesterday, our inpatient total was 10 patients. Today, we are at 17. It's still a considerable increase. But you know, I do monitor this number very closely in correlation with increase in cases. Usually we are still sticking to our trend of, if we do see a substantial increase in cases between days 15 and 17 from those reports, or when I see hospital movement. Currently, we have 136 occupied ICU beds in the county. Of that, 1.5% of them is COVID related. So only 2 inpatients right now are hospitalized and in the ICU for COVID. We do not have any pediatric ICU admissions being reported at this time. Obviously, these things can change, but we are hopeful with that. There are 17 ICU beds available being reported at this time. So again, the takeaway from that is that we are seeing an increase in ICU bed availability. And we are hovering in a pretty stable rate for ICU or hospitalizations for COVID-19. Next slide. We continue to monitor the vaccination status of hospitalized COVID patients as well as admission rates. For the month of April, of the 36 patients admitted for COVID, 56 have reported being fully vaccinated, while 44% report being partially vaccinated, unvaccinated, or unknown. We are presenting at an average daily admission rate of 1.8 patients. We have maintained around this average for a majority of the month in the 1.8, 1.5. This is something that I'm closely monitoring, keeping in mind that at our peak inpatient activity in December, we were averaging 29 patients a day. This is something that I monitor very closely. I do take into consideration age when people are admitted, just to keep an eye on if we're seeing any trends in any specific age groups for hospitalizations. Our vaccination clinics are still up and running. As I said, we do have some pop-up clinics. Right now, we are sticking with our HANU sites for our Word of Life, Bethel, Macedonia. That's Tuesday and Thursday for Word of Life, Tuesday and Wednesday for Bethel, and Monday, Friday, Saturday for Macedonia. We do have City of Flint vaccination sites still up and running. All of this information, all of our clinic schedules can be found at gchd.us. Next slide, please. We have one pop-up clinic on the books right now that is going to be at Hassel Brings Senior Center. That's Friday, April 29th from 4 p.m. to 6 p.m. If you refer anybody to this, please keep in mind that it is for ages 12 and up only. Anybody under 12 will have to seek vaccination from a clinic that will accommodate their age range. COVID testing is still an ongoing effort. We say if you don't feel well, definitely go get a test wherever you can, if you can. If you need a home test, they are still available by referral through the Greater Flint Health Coalition. Again, this information can be found on our website. No substantial or any changes to our testing locations. It's still going to be our 3 main HANU-based sites, which is PCR and rapid test done both by saliva as well as nasopharyngeal swabbing. All of these 3 run at the same time as their vaccination clinics. They are very, very consistent. You can make an appointment at these clinics or you can walk in. Just keep in mind if you walk in, there may be a wait. It's just going to depend on the day and the need. We do have drive-through testing sites still available. Those are the same as the last time. Our Walgreens site over off of Davison Road in Flint, as well as Hamilton Community Health Network does have a drive-through testing site. As with all the testing sites, no insurance is required. It is available for both adult and pediatric for most. The HANU sites I know will allow you to administer your own nasopharyngeal swab. Walgreens does self-administer nasal swab. And then, as I said before, our City of Flint testing sites are still up and running. And that's all I have for you today.
All right, wonderful. We love the depth of information that you provide for us, Ashley. Thank you so much.
Absolutely.
Speaking of City of Flint, we have Kiana Towns-Williams, who is the Manager of Public Health with the City of Flint, and she's going to fill us in on some upcoming events at the city.
All right, thank you, Heather Lynn. Good afternoon, everybody. I'll start by saying Happy Earth Day to all of you. When I was an undergraduate student at Central Michigan, Earth Day was a big deal. Everybody was outside on the lawns, and it was a celebration of the earth and a reminder of how it was our responsibility to take care of it. So I will say to you again, Happy Earth Day. Hope you get outside this weekend. Just a few community reminders as we've been having conversations this week in our community around animal cruelty. April is Cruelty to Animals Prevention Month, and the designated color and ribbon are orange. So the administration would just like to send a reminder to the community that if they identify any instances of cruelty to animals, those instances can be investigated by the Humane Society of Genesee County. There is a cruelty investigator on staff there, and they can be reached at 810-744-0511, or if you visit their website, geneseehumane.org, there is a drop-down tab for more information about how you can report animal cruelty. Next slide. In addition, we've also had some conversations here in our community about domestic violence and sexual assault. And so I thought it appropriate to use this time this week to remind our community that there are a number of resources available. This is just one of them that I am naming today. If you know an individual who is experiencing domestic violence or sexual assault, or if you yourself need support, you can reach out to the YWCA's Flint Crisis Hotline. Their contact number is 810-238-7233. And you can visit ywcaflint.org for more information. And this is for women, for men, for non-binary people. If you are experiencing domestic violence and sexual assault, please understand there is support in our community for you, and you can reach out to the YWCA for additional help. Next slide. And just a reminder, as we've been having the conversations today, there is some indication that our numbers may be trending up. And so we want to remind you that we do have available through the City of Flint the vaccination and testing locations. There's one at the North Flint mini station at 4535 Martin Luther King Avenue. It's just at the corner of MLK and Bishop. It is from 5 to 8 every Wednesday, and they offer both vaccination and testing at that site. At the Dorp Mall mini station on Fridays between 11 a.m. and 2 p.m., that's over at 3600 South Dorp Highway, just at the corner of Dorp Highway and Atherton Road. They are offering vaccination clinics again from 11 a.m. to 2 p.m. If you have any questions at all, you can give us a call here at the city. That number is 810-410-2020. We'd be happy to answer your questions.
All right. Thank you so much, Kiana. You guys, this has been such a wonderful hour that we've gotten to spend together. We have had wonderful speakers that came and gave us some great resources, some great information. I want to make sure that you don't forget about those two events that we talked about at the top of the hour. The first one by the Flint H2O Justice group. That's on Monday, and that's being held at Kersley Park. And then don't forget about that community conversation that the HFRCC, the Healthy Flint Research Coordinating Center, is sponsoring around indoor air quality. You can find this information on the HFRCC Facebook page. We want to make sure that you are connected and informed with all of those resources. But we got to show some love for our social workers and our community health workers. We got you. You know this. This webinar is eligible for both continuing education units and contact hours. If you have any questions, you can reach out to Atoisha. She's got you covered. Her email address is bassenia@msu.edu. That's bassenia@msu.edu. And I'll tell you, this is how it works. Once you exit our webinar, there's a internet browser window that's going to pop up, and it pops up with a survey that you can take. You fill that out and you're all set. That's all you have to do. And I know that the girls in the background are saying, Heather, make sure you say this part too. You have to use the same email address that you registered for the webinar. So that same email address, put that into the Qualtrics form, that survey that's going to pop up, because we want to make sure that you get those credits. But you can always reach out to us and we'll help you out. We got you back. This has been a great hour. I want to make sure that you like us on Facebook. Don't forget to do that. Subscribe to the YouTube channel. It's called Healthy Flint. Email us with any questions or for more information. You have any ideas of things that we should cover for topics, keep them coming. We want to hear from you. That email address is info@hfrcc.org, or give us a call at 810-835-2130, that phone number. And this information is in the chat just in case you miss it. But that phone number is 810-835-2130. But make sure you come back next Friday, join us. We will be heading into session 111. of the Flint Community Webinar on Coronavirus. We're so glad that you joined us, and we look forward to seeing you next week. Thanks.